Hello and welcome to the Senior Rehab Project, and you're listening to Home Health Recharge, recharging and revitalizing home health. Today we're going to talk to Alyssa Kuhn about her experience as being a new grad and coming right into home health. But first, I need to tell you this episode is sponsored by the Academy of Geriatric Physical Therapy. The AGPT works hard to provide us Geri PTs with high-quality content to help us advance our practice. This year, the Combined Sections meeting is a great example of that. The AGPT is offering 3 pre-conference courses in DC before CSM kicks off. This year, you will learn about the fundamentals of Tai Chi, how to apply a comprehensive approach to successful aging, or how to effectively manage kyphosis. So without further ado, let's talk to Alyssa.
So I'm here with Alyssa Kuhn, new grad PT home health rock star, right?
Something like that.
Alyssa is a new grad, recent new grad, and you've been in home health now for been a few months, correct?
Yeah, like 3 months.
Mm-hmm. But before that, you're one of those rare folks that have come right out of school and went right into home health. So
yes.
kind of wanted to talk to you about what your experiences has been with that, and but I want to first with being a new grad or being a student in a program. What was your impressions of home health from that angle before you even got into home health?
Yeah, so we had a couple of lectures on home health, and personally, I never saw myself going into home health at all. To me, it kind of just seemed like it was a lot of paperwork, but also it kind of seemed scary going in, with no one else but yourself to kind of rely on to make decisions and those kinds of things. So it seems kind of far-fetched in that way, just because, being a new grad, you need all this mentorship and you need, people around to kind of help you out to bounce ideas off of. So to me, it was honestly kind of scary because, you were the only one there versus in a clinic where all my clinicals were, you had constantly surrounded by at least like 5 to 10 other therapists that you can kind of rely on. So that's kind of why it seemed a little bit far-fetched to me originally.
Yeah, I think that part is always one of the more scary parts of coming into home health, is that being all by yourself, just you and the patient
Exactly.
sometimes, or you and the caregiver and the patient sometimes. And I know sometimes there can be that disconnect between bouncing things off.
Right.
I think one of the things that we're trying to, as you know, in the Senior Rehab Project, is kind of making a community so you can feel that support, because we do have a lot of home health clinicians that you can kind of bring your ideas and everything to.
Absolutely, and that was kind of one of the things too, is, yes, I'm by myself, but then I also have, these great resources that, you could reach out to as well, and people posting ideas of things, so that helped as well, kind of make the transition a little bit easier.
So when you first started home health, did your impression change any from being in school to actually getting into it now?
Absolutely. So my manager came with me or my boss came with me for a couple visits and kind of led me through how they typically run and things like that, as far as Oasis and things are concerned. And then I just kind of started right out doing just regular PT evaluations right off the bat. And so, yes, it did, because after about the first week, I was already put in situations where I was kind of unfamiliar with what to do, but then, you very quickly gain confidence, and it's like, oh no, I know the answer to that. Like, oh no, I can figure this out on my own. So you kind of very quickly gain confidence, and then, within the first 2 weeks, like, okay, well, maybe I can do this. Like, it's not as scary as it was made out to be. So it was a little bit overwhelming, though, with, scheduling patients and having 1 million things going on at once, like this patient needs this and this person needs this, and I have to call this person and call this office. So that was a little bit overwhelming at first, but I was able to kind of gradually ease into that as they kind of started me out at a lower caseload. But by like week 3, we were up to full caseload. But I think it was fairly easy to catch on to. The first month was a little stressful, but after that, it kind of became easier.
I know you kind of mentioned the scheduling of the patient's piece. I know that's one thing that some people you don't really think about when you're coming into home health, especially if you're used to another setting. You don't have to worry about it. Like you're in the hospital. I mean, you have to schedule out your day, but you don't have to worry about, driving to a patient's house or where do they live in relation to this, they're just from room to room. What are some of the most surprising things you found in home health?
So as far as surprises, I learned, I knew I was very directionally challenged, but that kind of was exponentially shown. So just getting used to like the geography of where things are and time efficiency. But honestly, most of the patients are wonderful. And, not really, phased by any living conditions or anything like that, which I think is a huge piece. Just kind of getting used to, not feeling awkward in someone else's home. So I feel like the first couple of visits, that's kind of how it was. But now it's just, I'm very used to it by now. So I think also another surprise would be the knowledge that's recommended, not necessarily in the PT part, but the kind of other resources part. How to, figure out, do you need a nurse on board? Do we reach out to OT? How do we get DME recommendations or orders from physicians? Calling physicians regularly, calling, like adult protective services or getting social work involved and when we can do that. So it was mainly the learning, kind of getting the grasp of how to incorporate those other resources, and not so much the physical therapy part. Because I think the physical therapy part helped a lot, being a part of Senior Rehab Project and, working with older adults before. So the PT part wasn't as bad. It's just the other things people need, getting familiar with medications and noticing, side effects of medications and reporting, adverse effects of things after total knees and things like that. So just you're responsible for more than just the PT part, which I guess I really didn't click immediately, and then, kind of start getting into it that way.
Yeah, you kind of turn into a jack of all trades almost. When you're...
Right.
What about the therapy that was being performed by others and you don't have to mention names or anything, but the therapy, the quality of therapy that you came into, that you're seeing in home health, do you
Yes.
see a difference?
So as far as like how I practice or other settings?
Both. Let's start with generally. Do you find the quality of others different in home health and then in other settings?
Yeah. Not necessarily. I think, home health is more getting people to, obviously move around their house better, just kind of walk around. I think it's more general as far as strengthening and just generalized weakness for the most part versus like an outpatient where you're treating someone for like shoulder weakness or something like that. You do have some specifics with, knee and hip pain and things, but most of the movements are just more general and more, you're just trying to get patients back to, doing what they used to be able to do, or so they're safe at home. Another thing is actually seeing more direct improvement as they're in their house. So as they're getting stronger, I helped one lady who hasn't been able to go up the stairs in over a year, and now she can go up the stairs and be with her family and things. So I think it's a little bit more rewarding, in my opinion, because you can actually see firsthand how these people are improving and how they're able to move around better in their house. As far as like, I mainly have other experiences in like outpatient, but you would set these goals and they'd get their range of motion, but you wouldn't actually see them if they wanted to get back to golf. You wouldn't actually see them do that kind of thing. So I think it's more rewarding in that way because you can actually see direct correlation from the treatment to function. And then I think the treatment, the plans of care, granted, you do have some patients that do have, long plans of care, but most of them I try to keep to, between 4 to 8 weeks, depending on obviously how they're presenting. But most of them are a lot shorter than I was anticipating. So I think that kind of varies because sometimes, in acute, obviously they're way shorter, but in outpatient, sometimes you have people on for months and months and months. And I kind of honestly thought that's how home health was going to be too. But for the most part, I, average out between about 8 weeks or so. So I think that was kind of a difference too.
So going back to, if you could go back and let your previous self know something about home health that you didn't know when you were a student, what do you think you would tell yourself?
That you know more than you think you know. And I know a lot of people always say that, but it's very true. People ask you a question like, oh, I don't know if I know the answer. But then, the answer that you're able to come up with is honestly, it kind of surprises me sometimes. But that just, I have the confidence and, our program was great. So they have prepared us very well for all settings so that we are prepared. And yes, it is challenging, but, it's worth it because it's a very rewarding setting, I think. So, yeah.
What about agencies that are hesitant to hire new grads? What would you tell those agencies? What would you like them to know?
So, which I totally get the hesitation, because it is a little bit of a, onboarding, and I feel like it's a little bit more work than seasoned clinicians. But as far as how our education has kind of progressed over the years, I mean, now it's a doctorate, but, with the current research coming out and that we have new grads, I feel have more access to resources that maybe other clinicians might not have had access to when they were going through school. So I would say to give them a chance and to not rule us out just because we're new grads. So, I mean, if you find something that you're passionate about, I think you should chase that. And so if somebody is passionate about, working with older adults or working in geriatric care, then I think, it's worth the investment because we're fresh, we're not burnt out, we, still have a passion, it's, very fresh ideas, those kinds of things. So I think there's definitely a lot of pros to hiring a new grad. Obviously it is a little bit more work and you do have to put a little bit more, front end investment, but I think it's ultimately worth it in the end.
I think you're kind of living proof that you can make it work, right?
Yes, hopefully.
What would you want the seasoned home health clinician to know, if anything, about working with new grads?
I would say to just be open to new ideas. And a lot of the PTs that I work with, we talk pretty frequently and try to share ideas as far as, new treatment plans and kind of what we should do with the tougher patients. So I would say just to be open to new ideas, because like I said before, with all the new research and things coming out, we're more required to keep up with that kind of stuff, especially through school. So I think we have a lot to offer as far as, fresh ideas, evidence-based practice. Now, obviously they have experience, which carries a lot as well. But and then also just, to be able to transfer knowledge to them as well. Because, I've honestly learned a lot from even practice going to co-treats with OTs. Mainly, I don't really get to go with other PTs, obviously, but I've learned a lot from OTs as well. So I just think both parties just being open to sharing new ideas and getting more knowledge that way.
That's a great point. I think we all have to be open no matter how much schooling or education
right.
or even experience that you have. Is there anything else that you would like anybody else to know that we haven't already covered?
I don't think so. It's a great profession. It has honestly shocked me how much I enjoy this setting. So I do very much encourage people to not write it off, especially coming out as a new grad. I do wish that we had more exposure to actual home health, being able to shadow and things, because we shadow in all other settings. But for the home health wise, we just had a couple lectures. So it's kind of hard to actually see the, actual carry out of home health when it's just through lectures, because, most things sound boring just through lectures. So I think that trying to get more exposure to even just shadowing 1 or 2 days, if people are actually interested in geriatric care and, working with older adults, to try and find someone to shadow, to see if it's actually something that you'd want to pursue. So you're not going in completely blind, because I had no idea. So just so you're not going in completely blind, searching for those resources, like I said, even just to hang out for a day or so, just to kind of see what it's like. Because I think that would help a lot as well. And people would understand, okay, it's not as hard or as scary as people make it seem. So yeah, other than that, not really.
Well, I think that's a good point. It can vary on where you're coming from on how much exposure you get in school. I know when I was going through, we didn't even have a lecture, you know what I mean? So unless you were already interested in it, you really didn't get exposed to it all that much.
Right. And we had a lecture I was on the Oasis. So obviously people were not exactly super thrilled about home health, because you get to fill out this 15-page document.
So let me get this straight. You had a lecture on the worst part about home health.
Yes, pretty much.
Carry you away.
So, yes. So I am going in to help out with that lecture next month, and so I'm going to put together like videos and tie in some of the stuff with senior rehab project and that kind of stuff to try to kind of open it up to see if anyone wants to come shadow or come hang out. To kind of open that up as far as, okay, yeah, you do a lot of paperwork, but, there is this whole other side that nobody really gets to see. So I'm hoping I can accomplish that a little bit. So.
Did you all get a lecture on the FIM or anything else in the other settings, or was it just the Oasis?
No, we didn't get the FIM. We got a little bit just like on home health in general, but it was mainly based around, insurance, and the different, qualifications for Medicare. I just remember going over like qualifications for homebound and a big part of it was the Oasis. It was probably a year and a half ago though, so I could be missing out on this. I think we had 2 lectures, but it was mainly on like the insurance paperwork side.
Okay. Yeah, you need to get in there and beef that up.
Yes, so I'm going in a couple of weeks, and we're going to try to spice it up a little bit. So.
Well, great. Well, I appreciate you coming and talking to me. I think everyone's
absolutely
with you and your great ideas that you've been posting and everything. And I hope you keep it up and keep pushing.
Yes.
Pushing your patients.
Yes, absolutely.